When you're looking at a slide under the microscope, you are doing pattern recognition. Pattern recognition lies at the heart of pathology. There is a specific language used to describe histological findings, and that is a skill that new residents sometimes struggle with. To help incoming residents with this issue, I prepared this video and will explain what many of the terminologies mean and how to approach and describe a slide. Pattern recognition is everywhere. It's not just useful in histology, it is something that we do every day without knowing it. This is a slide from one of Dr. Ari Perry's lecture. You must have heard by now that machine learning is being used to detect cancers and other things, other findings in slides. The way it works is through pattern recognition. However, it is not always perfect. You can trick augmented learning tools easier than you can trick a 5-year-old. But that is not to say that machine learning is not useful. It will help pathologists with our workload and detect things that we sometimes find tedious. Let's start by looking at a building on an island and think of it as a finding on a slide. You should start off by getting a low power view. See the general outline, see the surroundings, see any normal structures nearby. Most pathology diagnoses are essentially low power diagnoses. Next up, go to slightly higher power and look for finer details. But don't just jump straight to the highest power that you can possibly go to. Finally, if you need to go to look for specific things like mitoses or nuclear changes, then you go to higher power. I know that there's a tendency as a new resident to start going to higher power as soon as possible, but my advice is to sort of restrict yourself and sort of keep this discipline to try to make as many diagnoses on lower power after you learn a few things and not try to go to higher power as a reflex. So this is a list of things that you can appreciate on low power. And as you can see, this is a lot of stuff. And this gives you a lot of information to basically reach at least a differential diagnosis, if not the diagnosis itself. What does circumscribe means? Is the lesion circumscribed? This is something that you should know. Is it encapsulated? Or is it infiltrative? Or is it lobular or nodular? Those terms are used almost interchangeably at times. The term lobular or nodular implies that the lesion has a smooth contour conforming to or resembling normal anatomical structures. This is a summary slide for things that are described and some examples of what you can see in tissues and diagnoses that has these particular features. You can also roughly estimate cellularity of a lesion from low power, so you can classify them as hypercellular or hypocellular. Then going on to the stroma of a lesion, this is also something that you're doing in low power. There are different terminologies to describe the stroma, such as myxoid or fibrotic or desmoplastic. This is an interesting way of learning the difference between mucinous and myxoid, courtesy of my friend Lacey Durham. Moving on to probably one of the most important things that you can find on low power, architectural patterns. First one is an alveolar pattern. These are two of the many tumors that can show alveolar pattern. Basaloid resembles a BCC, or a basal cell carcinoma. It is a buzzword to describe the periphery of BCCs. This is another architectural pattern, usually seen as blood vessels showing a chicken wire pattern. Myxoid liposarcoma is one example where you see this type of pattern. Cribriform is a common pattern that you're going to see in a lot of tumors. Adenoid cystic carcinoma is probably like a prototypical, one, but DCIS can have cribriforming forming in the breast. Prostate cancer can also have cribriforming. Forming. It is very common. These are just very few examples. This is technically a patternless pattern, and you can maybe make it out to lymphoma, but it could be other things as well. This is another pattern seen in many soft tissue tumors, such as MPNST, malignant peripheral nerve sheath tumor, or synovial I was curious what a herringbone is, so this is what I found on Google Images, and you can do your own research. This is a very common pattern seen in GI and some other tumors as well. This pattern is usually seen with necrosis. These are some examples of geographic necrosis, as you would call this. This pattern is commonly seen in prostate cancer, and it is almost pathognomonic for it. Here is an actual glomerulus compared to a glomeruloid prostate cancer on the right side. You see this pattern in vascular tumors. For example, here. The politically correct term which should be used now is single file. This pattern is frequently seen in classic invasive lobular carcinoma of the breast, as seen here. Another relatively common pattern is microcystic. Many tumors can show microcystic pattern. This is a very common pattern, and you should know what makes a lesion papillary. Here are some examples from the kidney and the brain. You should probably also know what pseudopapillary means. Read up on your own on that. Micropapillary pattern usually means bad prognosis for the patient, wherever it is, doesn't matter which part of the body it is. This is a common pattern in tumors, especially endocrine tumors. You see pagetoid pattern you can see them in melanomas, breast cancers, and some other cancers as well. This is less of an architectural pattern and more of a description of how certain cells are arranged. There are different types of rosettes seen in different conditions, and attendings love to ask this particular question as to what is seen where. So you should know about this. Definitely read the differential diagnosis of each of them and impress your attendings. This is a pattern of blood vessels seen in some soft tissue tumors. I'm going to show you some summary slides that I found on Twitter page of a French pathology resident, and this is number 1 in those. I discussed most of these. Some of these are more common than others. Moving on to higher power. These are the things that you should look for when you go on higher power, starting off with different cell shapes. Epithelioid is a common type of cell that you will see in histology. These are larger cells. Some call them slipper cells, some call them chunkla cells, some say they look like boomerangs. Choose your own adventure. You'll see spindle cells everywhere, particularly in the soft tissue realm, but they can appear in almost any other organ. As an incoming resident, you should know 3 differentials for a spindle cell tumor off the top of your head: nerve, smooth muscle, or fibroblast. Here are some varieties of spindle cell lesions. Another type of cell shape that is small, round, blue cells. It can be hematolymphoid or it can be some other types as well. And I got a mnemonic for you. This is a way to remember the differential for these lesions. Photo credits Medscape. Rhabdoid cells you'll see most likely in soft tissue pathology. They have large pink cytoplasm containing cells with eccentric nuclei. Signet ring cells can be sneaky at times and can be confused with histiocytes, so people are always on the lookout for that, and you should be too. Here are a few examples. This is the case that I had, and the patient had this lesion in the stomach. On low power, you can easily call this diffuse inflammation, unless you go on high power and see these cells. These cells look like plasma cells, and there is a very broad differential for these, as was discussed by Dr. Marcos Lappe here, particularly in cytology. There are many types of giant cells, and a lot of times the subtyping is mainly for academic purposes. But I want you to read this slide, and then here are a few examples. I'll let you figure out which one is which. For cytoplasm, you can have tumors with clear cytoplasm, such as clear cell carcinoma of the kidney, but there are a lot of other tumors as well in the body that have clear cytoplasm. You can have keratinization, such as in squamous cell cancers, or you can have oncocytic cytoplasm with abundant pink material made up of a lot of mitochondria. Granular cell tumors have granules in their cytoplasm, and it can be found in a lot of different parts of the body. You can also have foamy macrophages within like these papillary type structures, and this is a papillary carcinoma of the kidney. So it is the papillae are not filled by blood vessels necessarily, but they have foamy histiocytes. Amphiphilic cytoplasm. It is a buzzword for pheochromocytoma, but it can be obviously seen in other tumors as well. To describe nuclei, you can use the terms pleomorphic, or you can call them hyperchromatic as well. You will also hear the terms salt and pepper, usually in reference to neuroendocrine tumors. Here are a few neuroendocrine tumors. Nucleoli can be prominent as shown here, or they can also be hidden, and in different cancers they're different. These are excellent books for learning about describing slides, and I encourage you to do so as soon as you start looking at cases. This concludes my video. This presentation would not have been possible if it was not for Jinping. He was an upper level when I started my residency, and he originally gave a similar presentation for us first years. I was inspired by him, and I have tried to keep the flame that he started alive. I wish you all the best of success in your residency and surgical pathology rotations.